ABC Listen. Podcasts, radio, news, music and more.
Hi, I'm Patricia Carvelis, the host of the Politics Now podcast, where I'm joined by the best of the best at the ABC to break down the latest in politics, including, for the next little while, the wonderful Melissa Clark.
Oh, thanks, PK. That's right. For the next couple of weeks, I'll be joining you for the party room while Fran Kelly takes a break. And we'll keep on zooming out and taking stock of the week in politics and analyse what it really means for you. So follow Politics Now on the ABC Listen app so you never miss an episode.
It's no secret that if it continues as it is, the National Disability Insurance Scheme will become financially unsustainable for the country. But is moving kids with autism off the scheme really a good idea? Today we talk to Jess Otter, whose son has autism, and to the ABC's Disability Affairs reporter, Nas Campanella. I'm Sam Hawley on Gadigal Land in Sydney. This is ABC News Daily.
I'm Jess, and I have two children who are neurodivergent, and I myself am neurodivergent.
So, Jess, tell me about your son.
Yep.
Because he has autism, doesn't he? Just tell me how he was tested for that and then diagnosed. So take me back in history just for a moment.
So when he was 2 years old, he was not speaking, and so we went for the assessment and he was diagnosed at 2.5 years, and he was diagnosed with level 3 autism.
Just explain, what does that mean? What does level 3 mean?
Yeah, so that's the most support needs. He has significant support needs, mostly non-speaking. And so he has very significant needs and doesn't sleep well. And that's kind of a very big factor in, I guess, our quality of life as a family and himself as well. He will wake up from about... Sometimes it's like 1 or 2 in the morning and he's awake for the day. Gosh. He's quite hyperactive. He needs to be monitored and supervised. And so he does require support with most of his needs, so feeding and dressing and making sure that he's healthy and clean and all of those things.
What sort of support do you get from the NDIS at the moment?
Currently we get speech therapy for him, occupational therapy. He gets behavioural therapy and also core support. So he gets a support worker to come in.
With that said, how are you feeling about this government change? Do you know what's in store for you and your son when it comes to the NDIS at this point?
No, and I think that's what's most stressful about these talks of changes and things is that they haven't detailed what these supports are going to be. So it's basically, at the moment, we're hearing all these kids are going to be pushed off the NDIS, which is supports that are already in place. People already have therapists on board that their kids have grown with, and now they're going to be pushed off that. I've had many conversations with parents and everyone's just, fuming.
As the federal government works to rein in spending on the National Disability Insurance Scheme, it has announced a new program to divert children with autism and developmental delays from the scheme.
Children with autism or developmental delays make up 44% of the scheme. Many of those children will now be diverted to a new program called Thriving Kids.
The government argues change is urgent because the cost of the NDIS is currently unsustainable, risking public support for it.
And the Health Minister has outlined a plan to reduce the growth of the NDIS by setting up separate supports for kids with developmental delays.
Children with mild to moderate developmental delay or autism need a robust system of supports to help them thrive. A program for thriving kids. And that's the program that I intend to deliver.
Hey, I'm Nas Campanella and I am the ABC's National Disability Affairs reporter.
Naz, let's have a look, or a deeper look, into the government's decision to remove autism from the NDIS. It's good to start, I think, with you by looking at the rise in the number of cases of autism in Australia, because the increase has been really quite extraordinary, hasn't it?
So what I'd say is there's always been a high number of kids on the National Disability Insurance Scheme. So in June, approximately 11% of all kids between 5 to 7 years of age were actually on the scheme. Figures show pretty huge numbers of the kids are actually aged 6 and they're boys. So that make up a kind of a big swathe of that. When you look at the kind of rate of participation of kids in the NDIS, it kind of starts to peak from birth and then reaches about 12% around 6 and then declines from age 35 to 40. Now, what that is showing is that kids are in the program early on in an early intervention pathway. I guess the problem is that a lot of the kids have stayed in the scheme. Now, when I spoke to advocates last week about this idea that there's this over-servicing of kids, more therapy than they need, I guess. The over-servicing came from Minister Butler's speech.
On average, just an average, a young NDIS participant with moderate needs is receiving more than 70 therapy sessions in a year. Now, there is no evidence that I'm aware of that supports children being taken away from learning and other activities for that much therapy. And the scheme doesn't...
The advocate said there are certainly a lot of kids in the scheme and they're getting a little bit each. So there's lots of packages being given to a lot of kids, but each of them, the packages are quite small of funding.
So do we have a sense, though, of how many kids with autism are on the scheme at this point? Do we have those figures?
Yeah, so the scheme's got just under 740,000 participants and about 23% were younger than 9. 40% had a primary diagnosis of autism. So it is significant and no one can or is denying that.
And in a sense, Naz, this increase in diagnosis of autism in Australia, which is apparently autism in Australia is among the most prevalent in the world, that comes back to the fact that we have the NDIS, right, and you need a diagnosis to get the funding.
Well, the NDIS is really shifting its kind of take, and it's very much saying it's about your functional capacity and what do you need to live a good life and thrive. The key thing here is, we've got this rollout date for Thriving Kids of July 1. That's 11 months' time. And what many people are sort of wanting to focus on is this idea of, this could actually be a really good thing. Lots of advocates have said that. In theory, it's a really good thing and hopefully it lives up to its name and does help kids thrive. But I guess the question is 11 months' time enough time to have the consultation with the community, have the co-design with the community, and then also figure out all the procurement processes and the logistics of how it'll actually work. It could actually be a really good thing to make sure that people with less significant autism, I won't say less significant and not permanent because I want to be very clear that autism is permanent, but maybe this group of people who kind of can fall into this second tier don't necessarily need the supports on the NDIS.
Okay, yes. And $2 billion, that's what the federal government will put into this new program. That is significantly less, Naz, than what they'd be spending right now. So is this going to be enough? Surely people are concerned that it won't be enough funding available at this point. Or are there enough kids in the scheme now that don't need the help they're getting?
Look, $1 million question, right? The problem is we don't have the detail, and that's what people are going to be asking for now. And ultimately what families have told me, we don't actually care where the services and supports come from. We just want to know that if and when our kids need it, it's going to be available, it's going to be easy to navigate and easily accessible for our kids and not put them out of pocket thousands and thousands and thousands. That's another thing people are worried about. But ultimately, the devil will be in the detail, Is it going to be enough funding? That'll remain to be seen. How's it going to work? Not sure. Who's going to deliver the services? Not sure.
Yes.
Those are the questions that people have now.
Yeah, a lot of unknowns. The Treasurer, Jim Chalmers, he was on Insiders on the weekend, and he was really sort of heavying, if you like, the states, that the states really will need to be involved in this new scheme.
In this instance, when it comes to thriving kids, we've put a couple of $1 billion on the table, and that's because we want to work with the states, not at cross purposes, to make sure we can deliver for people in the NDIS. That means making spending on the NDIS sustainable, and it means providing the kind of support that particularly kids without permanent and significant disability still need, but elsewhere in the system.
Well, I think no one's under any illusions that everyone needs to be on board so that the approach is kind of rolled out in a clear, concise and really direct way. And also for many people, they remember what some of the services were like in the states and territories before the NDIS. And many of them, in many cases, were not good, which was precisely why they fought so hard for the NDIS in the first place.
But the NDIS, when it was first established, Nas, by Julia Gillard, it was designed for people with permanent and significant disabilities, wasn't it?
We are determined to create a new body, disability care, which would ensure that the current underfunded, fragmented system of services is replaced and replaced for the long term. That Australians with profound and significant disabilities would get the support that they needed.
I think it is crystal clear that there are 5.5 million people in Australia with disability, 20% of the population, and this scheme cannot support all of them. Fiscally, it is not possible, and everyone is in agreement that it cannot continue the way it is. Otherwise, it will not be sustainable. It already is unsustainable, and it will not be there for generations to come who really do need it. The issue now is, how do you create a system outside it that will still provide that support and that will be what people need? But you are right, the original intent of the NDIS was for significant and permanent disability. But I guess what I'd say is, I hear time and time again the question of which of our kids will be on the NDIS and which of them will go into this new Thriving Kids, and some people just wanting a reassurance that, there are different sort of, autism, for example, is a spectrum, and the supports look very different from one person to another. So you might have someone who simply just needs some support to get out into the community, or some support to understand social situations. And then you have people who have much higher support needs. And that could be anything and everything from feeding. It could be actually needing support to shower and bathroom and all those sort of more high-level support requirements. And so I think many of the families I've spoken to recently have said, does my kid really, is that someone who needs to go in this new Thriving Kids when they definitely need 24/7 care and support?
All right. Well, Naz, as you say, it's a really uncertain time for a lot of families in Australia. And the thing is, there could be more to come, right? Have you got a sense that this is the beginning of the changes to the NDIS and that the government is looking more broadly at this point?
Yeah, look, the Treasurer Jim Chalmers and Minister Mark Butler have specified that it is likely they will look at further reforms. I think what I'd say is the community has dealt actually with a lot of change and a lot of transformation in recent time. And in good faith, the community has given painful evidence to a Disability Royal Commission, put in hundreds of submissions to an NDIS review, put in submissions to a task force that was looking at registration of NDIS providers. And a lot of this work is still up in the air. They sort of haven't seen the fruits of that work yet. And so I think some of them are sitting back thinking, okay, more reform, that's fine, but what does it all mean for us? And I think that's sort of what needs to happen now, that there needs to be that detail and that level of understanding of what this means for the disability community and actually provide the answers that it requires.
Nas Campanella is the ABC's Disability Affairs reporter. Jess Otter's son has autism. This episode was produced by Sydney Peed and Cinnamon Nippard. Audio production by Sam Dunn. Our supervising producer is David Cody. I'm Sam Hawley. Thanks for listening.